Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
The announcement of Uganda's first COVID-19 case caused a little panic in many people here. However, the Ministry of Health had now come to reality with the fact that it has to deal with the infection by all means. The lockdown was quickly instituted to help in understanding the disease, according to the president. But researcher at Makerere University College of Health Sciences, Dr. Olive Kosinje, who is also well-versed with the medical emergency systems, says we have since dropped the ball as regards the lockdown.
We've spent a whole lot of time, we've spent the entire lockdown period focused on trying very hard to prevent infections coming into the country, and we've not done enough to prepare the healthcare system within the country to cope with the infection, which is why only a couple of days ago it emerged that regional referral hospital, LIRA, that the response to the pandemic was under junior staff, that they did not have sufficient supervision from senior people that were more experienced, the health workers didn't have sufficient support. So I think we've squandered the opportunity that we had, that the infection hadn't really hit us, and that we had sufficient time to prepare.
Uganda has embarked on easing the lockdown. However, the number of infected people is also rising. We have so far passed the 500 mark, and we are yet to see more. In the last address to the nation on COVID-19, President Museveni assured the public on our readiness to handle the disease.
We have created the hospital bed capacity of 2,000. These are the ones dedicated to this virus. But we can quickly scale up the treatment by building tents in some places, and if it became necessary, we could scale up to even 40,000 beds.
We seem to be making it up as we go along. How many beds do we need, and about how many doctors do we need, and how many television sets per we don't seem to have a roadmap. We have had sufficient time to prepare. We know exactly where our health facilities are in this country. We have only 14 regional referral hospitals in the country. So there was no excuse for those 14 hospitals to not be adequately prepared, considering that we've been planning and preparing for this for the last few months.
After the outbreak, the Ministry of Health put out a call for an emergency recruitment drive for additional health workers. The ministry at the time proposed to engage 210 health workers for a 6-month period. Dr. Kosinje describes this as a knee-jerk reaction to a system that has been mismanaged for long.
We've spent the entire lockdown period chasing every truck driver that came in with a positive test, but we really haven't taken care of all of those things. And as I said, many of them are not things we can fix in a day. I mean, if we didn't have laboratory technicians trained, if we didn't have nurses trained and in place, you can't snap them into place.
Dr. Joel Okulo, who chairs the Medical and Dental Practitioners Board, says this shows that the health system is not fully employing all health workers available.
We churn out about 500, 600 doctors a year, so that the total number of doctors that are on record is something like 7,000, but only about half of that are active in service. If you look at the number of nurses, they are about 70,000, and I think if those are deployed in this kind of setting, it should be enough to address the problem of COVID.
It is still not clear when COVID-19 will be completely wiped out. The former Director General of Health Services, Professor Francis Omaswa, has advised government to invest more in human resources, especially high-quality professionals.
Make sure that our health training institutions are well funded, are well managed, so that the people who enter the training schools, who stay and graduate from the training schools, are prepared to be coming out as skilled and compassionate health professionals. We have managers for health workers in the country, in the Ministry of Health, there is a vacancy there which has not been filled, to my knowledge, of health professional development, I think, commissioner. That position is very, very critical. It should be filled with an appropriate person with skills to link disease burden to health skills.
Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.